Hello everyone. Today we are going to discuss two of the topics of cardiovascular system. The first one is the coronary circulation and the next one we will discuss later is RAS or renin angiotensin aldosterone system. So within the coronary circulation, these are the certain topics that are needed to be covered today. The first one is physiological anatomy and peculiarities, factors affecting the coronary circulation, ischemic heart disease, myocardial infarction and angina pectoris. Our main focus will be on angina pectoris. It forms an important part of the lecture, right? So first, getting on to the physiological anatomy, as we can see here, this is the ascending part of the aorta and we can see there are two branches, namely the left coronary artery and the right coronary artery supplying the heart. These are the major arteries which supply the heart and as well as the muscle layer as well, right? So these coronary arteries lie on the surface of the heart, as we can see, and these give off various branches which actually penetrate the different layers of the heart, right? As we know that there are three layers of the heart: the epicardium, which is the outermost one, then we have the middle layer or the myocardium, which consists of the cardiac muscle tissue, right? And there is the innermost layer which is known as the endocardium. Now there is one more point that we need to understand, that the inner 1/10 mm of the endocardial surface, that is 1/10 mm of thickness of endocardium, is actually supplied by the blood which is present directly in the chambers of the heart. But we can see that this nutrition is almost negligible and hence the main coronary supply is needed for the complete adequate nutrition of the heart, right? So another thing that we need to know, that the normal coronary blood flow is 5% of the total cardiac output, and the coronary venous drainage is usually through the coronary sinus, which mainly drains the right ventricle, and minorly the right ventricle is also drained by the anterior cardiac veins. We also need to know about the Sebacean veins, which drain the myocardium of all the chambers, and these actually drain into all the chambers of the heart and form the physiological shunt. You'll read more about this in the respiratory physiology, so we won't discuss it here. Next topic that we need to cover are the factors affecting the coronary circulation. So the first factor that we need to know about is the cardiac muscle compression. So this actually states that whenever there is a systole, that is whenever the heart contracts, there is compression of the intramuscular blood vessels and hence the blood flow to the heart decreases. We saw it earlier that there are many branches coming out of the main coronary arteries which penetrate the heart muscle and get deeper into the heart layers, that is the endocardium, and hence these are the vessels we are talking about which get compressed during systole. So the mainly blood flow usually occurs in the diastole, as is represented from this graph. We can see that during the systole the blood flow is very much less, while during the diastole the blood flow increases to a proper amount so that heart can get its adequate nutrition. So all the conditions in which the timing of the diastole decreases, such as the tachycardias, or we can say the arrhythmias or flutters, the blood flow to the heart will also decrease and it will lead to the problems we will be discussing further, right? So the next topic, or the next factor rather I would say, that affects the coronary circulation are the local metabolites. So the thing that you guys need to know, that oxygen demand acts as a major factor in local coronary blood flow regulation. So whenever there is decreased amount of oxygen or the hypoxia in cardiac muscle cells, there is large amount of ATP that converts into AMP. Some part of AMP gets converted or gets degraded into adenosine. Adenosine hence itself acts as a potent vasodilator and increases the local blood flow. So basically you can see that oxygen demand, if it increases and there is relative hypoxia in the cells, then consequently the local blood flow will increase due to adenosine, right? The next factor that we need to discuss is nervous control, which can be either direct or indirect. In case of direct nervous control, it is done via neurotransmitters. So the two main neurotransmitters that we need to discuss here are acetylcholine and norepinephrine. Acetylcholine is usually released from the vagus. It is mainly released from the vagus and it causes vasodilation. While on the other hand, norepinephrine is released by the sympathetic nerves. It causes vasoconstriction via alpha receptors. So what is the concept of alpha receptors here? here, let us discuss a bit about this so you guys can be crystal clear about these receptors. So basically the sympathetic nervous system acts via alpha and beta receptors, right? So these receptors will either stimulate an organ or they will inhibit an organ. So mainly the alpha 1 receptors are usually the stimulatory receptors. Whenever any neurotransmitter will act through these receptors, the organ will get stimulated. For example, the blood vessels, they will constrict, or you can say the pupils, they will get dilated. As we know that in sympathetic nervous stimulation, we see that the pupils of the person get dilated, right? So alpha 1 receptors are mainly for stimulation of an organ, and the beta 2 receptors are mainly for the inhibition of that organ, right? So beta 2 receptor stimulation will actually cause vasodilation. Are you guys getting? So we have discussed about alpha 1 and beta 2, right? On some organs, on the other hand, the alpha 1 receptors are absent. On the other hand, beta 1 receptors are present. For example, the heart muscle and the JGA apparatus or the juxtaglomerular apparatus. Here the stimulation occurs through the beta 1 receptors. I think this is all you guys need to know for now, and it will be covered in more detail in autonomic nervous system. So getting on to the indirect nervous control, we can say that the indirect nervous control occurs via secondary changes in coronary blood flow caused by increased or decreased activity of the heart, right? So let us understand it in more detail. Whenever there is any kind of sympathetic stimulation, we know that the heart rate as well as the heart contractility, both of them increase, right? So the demand for oxygen will also increase. This will lead to increased blood flow and hence vasodilation occurs. We talked about it earlier that whenever there is increased oxygen demand or there is decreased relative oxygen in the cardiac muscle cells, there is release of adenosine and hence this causes vasodilation. Same is the mechanism that occurs here. On the other hand, in case of parasympathetic stimulation, there is vasoconstriction as the heart rate decreases, though there is no much effect on the cardiac contractility because the vagus does not innervate the myocardium of the ventricles. So mainly there is decreased heart rate in case of parasympathetic stimulation, but since you know the work of the heart has decreased, so that's why vasoconstriction occurs to limit the amount of blood flow, as it is not much needed in this case, right? So now getting on to the next topic, that is ischemic heart disease. First, let us discuss that what actually is ischemia, right? So ischemia is the decreased blood supply to the tissue. Ischemia can be of any organ, not just heart. It can be of the bowel, it can be of the muscles, it can be of any organ, right? So ischemia is a general term, and when it is applied to the heart muscle, right, when the heart is not getting the enough blood supply, we term is that ischemic heart disease, right? So in case of ischemia, there is not just decreased oxygen to the cardiac muscles, there are also decreased nutrients and decreased excretion of the metabolites, right? Whenever there is blood supply is decreased. So the most common cause of IHD or ischemic heart disease is the atherosclerosis, which basically means that within the vessel, you can see there is a plaque formed within the vessel, and hence it poses as an obstruction to the blood flow, right? This gives an obstruction to the blood flow, and hence the adequate supply of the blood is not present in this case, right? So whenever there is partial occlusion of the artery, like in this case, we can see that there is decreased blood flow through the vessels, but you can see that there is no complete obstruction, right? Some of the blood is still flowing through the vessels. So there is pain in the heart muscle because of decreased blood flow, and this is what we call as angina pectoris. We will be discussing about it later. Just now, whenever there is complete occlusion of the artery, as if this is the plaque and it has completely occluded the artery, we can see that there is no blood flow in this case, right? So what this actually leads to is known as death of the myocardial tissue, which we commonly call as myocardial infarction, right? So now getting on to the main topic, that is angina pectoris. So let us first discuss that why there is pain in angina, right? So we see that normally heart muscle actually uses fatty acids for energy production, as we know that even a single fatty acid can yield up to 30 to 40 ATPs. On the other hand, glucose needs to be metabolized in a much complex form to release ATP, right? So but you know, guys, that what happens is that whenever there is decreased blood flow to the cardiac muscle cells actually shift from fatty acid oxidation to anaerobic glycolysis, right? So this as you can see that in case of anaerobic glycolysis, there is decreased amount of ATP produced, plus there is release of lactates. These lactates actually irritate the nerve endings supplying the heart, and they cause pain. Right. So what is the site of pain in this angina pectoris? It is the left arm, the left shoulder, neck, and side of the face. The aggravating factors are exercise, emotions, cold temperatures, and postprandial. Basically, all those conditions which will decrease the supply to the heart will aggravate the pain, right? In case of exercise, there is increased blood flow to the muscles and not to the heart, right? So this will aggravate the pain. In case of emotions, we see that there is sympathetic nervous stimulation, and hence the heart rate increases. The supply is actually not so much, and the demand for oxygen as well as the other nutrients increase. So hence in this case the pain will aggravate. In case of cold temperature, the cutaneous vessels, means the vessels that are present just beneath the skin, they need to dilate in order to supply more warm blood to the peripheries, and hence the amount of blood that reaches the heart decreases, right? So this also increases the pain. In case of postprandial, that is after eating food, we see that most of the blood is being shunted to the bowel, right? Because we need to absorb the nutrients, the digested food, we need to absorb it, and hence there is decreased blood supply to the heart at that point of time, and it aggravates the pain, the anginal pain, right? So what are the relieving factors? The relieving factors are obviously they would be rest, so that the heart load decreases, the work of the heart decreases, and there are certain vasodilatory drugs that the people usually use. One of them is nitroglycerin, and the beta blockers, the propranolol. These are some other drugs that are mentioned in the guidance, and you can remember them if you want to, but these are the main two drugs that you guys need to remember for now, right? So nitroglycerin is a very common drug that people use for angina. Basically, it's a small tablet, and you can just place it beneath your tongue. It gets absorbed some liquidly into the blood vessels, directly into the blood stream, and it shows the effect immediately, right? So whenever the patient has pain, he takes this tablet, puts it in just beneath his tongue, and once the effect is shown and the pain is weared off, then the patient can even spit off the remaining tablet, right? So this is the concept behind the nitroglycerin. So there are certain surgical options as well for treating the ischemic heart disease, that is what we mainly think as atherosclerosis as its main cause. So the first one is aortic coronary bypass surgery. So here I have made just a small representative diagram for the same. So as we can see that here there is a plaque in the blood vessel, and you see that there are branching off of the vessel as well ahead. So what we do, that we take a suitable vein, basically from the thigh, we can say the main vein that most commonly used vein that we take is the thigh from the vein, that is the great saphenous vein. It is actually put in such a way that all the blood gets shunted from the artery to this vein, and then it bypasses the plaque. So you can see that we have actually bypassed the plaque, and blood flow is occurring easily, and hence it is increasing the blood supply to the heart now, right? So the next option that we have is angioplasty. Basically what we do in angioplasty, that we place a catheter within the coronary artery, right? So here we can see that there is a catheter being placed in the coronary artery, and you can see that this is all plaque that is being formed within the vessel. So we actually inflate this catheter, and you can see that there is this mesh like material, right? This mesh like material is actually called a stent, right? So the stent is also placed over the catheter. We just inflate the catheter, the stent also expands in size, and what happens is that once we expand this catheter, some of the atherosclerotic plaques also breaks off, and once inflated, the balloon is taken out, and we can say that this stent is placed, right? This stent is placed within the artery, so that adequate blood supply is ensured through the vessel, right? So these stents usually get fibrosed within the ears. So some new inventions have been done, and now these stents are actually coated with certain drugs which decrease the scar formation over these stents, right? And the last option that we have are lasers. Basically, this is a very new option, and what it does is that lasers are also introduced in a form of catheter within the vessel, and then they actually destroy the plaque within the vessel without destroying the other tissue. And this is a very new technology and not being used very frequently these days. Maybe it will be frequent in the coming years. So yeah, this is one of the options to treat IHD, and this is all about coronary circulation. Thank you. We'll just get on to the next topic, that is RAS. Thank you so much.